we started small, at least relatively speaking. We treated 98,000 people in the first year, but we've now grown to be treating around about 670,000 people a year. We see more than that. We see about 1 million, but when you assess people, not everyone turns out to have anxiety or depression, or the problem is mild and they could just benefit from some straightforward advice. But we end up with that 670,000 people that we give a course of treatment to. And once we've started a course of treatment, so once you've had an assessment and at least one session, then we commit to recording your outcomes. And we use a simple session-by-session outcome monitoring system to make sure that we do get data from you, even if you don't turn up to your last session, for example. We can take how you're doing at the previous session. That system has worked really well. We do get outcome data on 99% of that 670,000 people. Waiting times before we started this were long in England, but they've dropped to an average of just 20 days before you start treatment. And the clinical outcomes now are broadly in line with our expectation from the research studies and our target, which was 50% recovery. And you can see that on this slide here, where we've plotted years into the program, and then the red line is the recovery rate. So the first thing to notice is that we were quite a bit short of our target in terms of recovery in the first couple of years. And if we hadn't been collecting outcome data on everyone, I guess we'd still be in that position and blissfully ignorant. But 100,000 or so patients would not be benefiting each year if we stayed that way. So, but because we were collecting data on everyone, we were obviously able to spot quite a lot of variability in the outcomes of our different services. Some were already the 50% outcome target, others were way below. And so we studied the differences between the services, fed that information back into the services, and they sort of innovated on the basis of that information. As you can see, we've steadily improved our outcomes. And then for the last 7 to 8 years, every year, we've been at our target for over 50% of people recovering. And the dotted line shows the number of people, or the proportion of people who've shown really substantial improvement, reliable improvement. That's obviously a higher figure still, pretty close now to our 70%.